Hello, and welcome to another episode of Real Talk on Renal Cancer, sponsored by the Judy Nicholson Foundation. We also get gracious support from Merck, and I am so excited today to have Annamaria Scaccia with me. I've known Annamaria for a long time, and her story is incredibly inspiring, and I can't wait to jump in. So, welcome to the podcast, Annamaria.
Thank you for having me. I'm excited to join.
I know. I'm really happy to have you here. I feel like this is like a podcast crossover.
It is, yes, and I love it. I love it,
I
especially because,
know.
oh, sorry, I was just going to say just because, since JNF is one of Kidney Cancer Association's affiliate partners too, it's like
Yeah,
it's a lot of family love, if you will.
it really is. It's one big family. So I'm
Yeah.
really happy to have you here. Well, you have had quite the journey with cancer. If you maybe want to share a little bit more about your experience of being diagnosed in 2020 with chromophobe.
Sure, yeah. So it really starts, my story really starts, I'd say July 2020. Because around that time, my healthcare provider, my doctor, was looking at my kidney labs and she thought that it just didn't look right for someone of my age and my fit level. And so we did a few things like she had me eat less protein, she had me like work out less, and they still were just out of whack, if you will. And so she sent me for an ultrasound. And not even 2 hours later, was told that they found a mass and I had to go for an MRI. And I went for an MRI. And on September 30th, 2020, at 11:30 a.m. Central Time, is when my doctor called me to let me know that I had kidney cancer. It wasn't until after the surgery, I had my left kidney removed. It was supposed to be a partial, but when my doctor went in, my urologist went in, he saw that the tumor was too close to the renal veins and he just did not want to risk leaving any cells behind. And I know treatment and knowledge and research has changed since then, but that was kind of just he did not want to risk it. So he took out my whole left kidney. And that was on October 26, 2020. And that's my experience with kidney cancer. I don't know if you want me to go into the whole cancer experience or just kidney cancer.
No, I mean, please share, more about your experience because you've had a journey, my friend. You've had a
Yeah.
journey.
Yeah, thank you. Yeah. So then 2.5 years later, I was diagnosed with papillary thyroid carcinoma. It's actually interesting. Um, that was in May 2023 when I got the official diagnosis. But I actually felt the tumor in December 2022. And I was on my Peloton and I felt like this thing pop. It's just a weird thing. Like I felt something pop, and then all of a sudden I felt this like lump on my thyroid. And I couldn't get an appointment with my doctor until April of 2023, partly because I kept putting it off because I knew it was cancer. Like, you've had it, kind of thing. And then that's where it snowballed. And then in July of 2023, I had my whole thyroid removed. And then in January of 2024, I had radioactive iodine, and it actually will be a year um, this week is a year since that, since I had radioactive iodine. And so um, there's still cancer in my body. There's microscopic disease, but my doctor is comfortable saying I'm Ned. So as long as I'm on a high dose of Synthroid, which is my thyroid hormones medication. But yeah, that I don't know if I should share all of it because recently I had a colonoscopy and they found a precancerous polyp. And it was large enough where I'm in the intermediate risk of cancer category. So I have to get another colonoscopy in 5 years. So when people start going to get colonoscopies, I'm going to go for my second one. And so that's been a hard pill to swallow. Because it's one of those like my oncologist is like, it's not totally uncommon. And I'm like, when you add totally in there, it makes it uncommon, right? Like
Right.
it's like, so it's like
Yeah.
the idea of me potentially having a third primary has been something I've been working through. So that's my cancer
Yeah.
journey. That's a lot.
I've said for a long time that I really feel like cancer should be like a get out of jail free card. Like once you've had a cancer diagnosis,
Yes.
I feel like it is very unfair to then add more primaries on top of that. Like
Yes. Oh my
I
God.
just I'm just saying, I know that's not how it works to be clear for our listeners, but it just feels very unfair to have to go through two primary diagnoses. I mean, that's a lot.
It,
So yeah.
I know.
Well, yeah.
Sorry, I feel like I keep cutting you.
Oh,
It's
no,
the
you're
way,
not. No.
you interrupt all your life. You can't stop interrupting. No, I agree. I think one cancer should be enough, and like having two primaries, um, is not common. It's not common to have two primaries. It's not. And the thing is, I don't have any genetic markers.
Right.
Like I did full genetic counseling. I even went back to my oncologist when they found the precancerous polyp. I'm like, hey, can you like, what's going on here?
Make
Like, did
sure.
you do it again? He's like, no, it was like pretty extensive, and like
Yeah.
there's no genetic markers. So for me, it's like, okay, why do I have two primaries? Maybe the precancerous polyp could be associated with the radioactive iodine because that is a potential risk of a therapy like that. But it's like, what's my body doing to me? Because there's no like genetic marker to it. So
Yeah. Yeah. I'm sorry that you're going through that. And I know it's challenging for any patient to go through, but I feel like it's especially unfair for someone who has really dedicated a lot of her life to fitness and, taking care of her body. And that's tough, Anna Maria. Like, that's tough.
yeah. And that's the thing. It's so I'll give you a bit of I guess a backstory prior to cancer. So I've been heavy all my life, right? I was always into like sports and fitness, but I didn't necessarily grow up in a situation where that was promoted per se, right? And then I entered a bad relationship where my strength was seen um, as a bad thing, right? And I don't necessarily want to get too deep into that stuff, but until it wasn't until I left that relationship and I was like in my mid 30s where I actually got to um be fit the way I wanted to be, right? Because again, it's not like, I mean, when you're larger all your life, you do internalize those messages of what your body's supposed to look like. And you do get bullied for it and stuff. So there was always that part of me that of course I wanted to be skinny and things like that, right? Um, but I was always attracted to physical fitness and like pushing my bodies in a way and building up strength. And so once I left that relationship, I was actually able to really come into my own with fitness and nutrition and like really like take care of myself. And then yeah, then cancer happened. And so for me, it's like it's tough because it's like I finally got to this space where I felt like myself and I was doing things for myself in the way I wanted to do it. And I didn't have this person knocking me down and making me feel bad for not having an issue with my muscles or an issue with strength. Um, and I was able to, use that as an outlet and kind of, just explore that. And then I got cancer and things have changed since then. I still kept up with my fitness and nutrition and I got into bodybuilding. But the thing is, it's like before that I was doing kickboxing and now that's not, unless I do cardio kickboxing, like competing in that is not really necessarily an option for me. And I know you can, I mean, I won't get on that, but I know there are ways you can do it, but like it had to change. Like there was a way that it had to change.
Yeah, well, and thank you for sharing that. I know, it's challenging because I feel like with some people, life, cancer kicks you at like the worst times,
Yeah.
right? And not that there's ever a good time to get cancer, but for me, like when I was diagnosed, it was right after my 29th birthday, and I was like struggling a little bit with the idea of turning 30, and like leaving my 20s, but at the same time, I was like doing really well in life at that point. I'd just been promoted at work the year before, and I was like kind of riding high, and then you get blindsided by something like
Mhm.
this. And so, you mentioned that your fitness journey has really changed since your diagnosis, and I'm amazed by what you do because honestly, like it is a struggle for me sometimes to just like do Zumba on a regular basis, which I loved doing Zumba before my diagnosis, and
Yep,
like I can do it now, but I mean it's tough, like my stamina isn't what it used to be.
yep.
I'm also on Synthroid for I have residual side effects from being on treatment as long as I was, and so it's tough. So, we all hear that physical activity and diet is really important whenever you have cancer, but how do you manage that? Like how does that work for you?
So for me, and I probably take a long way to answer this question. So for me, fitness and nutrition became a non-negotiable, right? And a lot of it tied to trauma and PTSD and stuff like that. And he was using it as a way to grieve my dad's death as well. So it became like a grounding force for me. And so when I got the first diagnosis, I made a post-surgery checklist to make sure that I can still maintain that, right? And find ways to still get back to my body. It was hard, I would say, with the first diagnosis because I still found the ways to keep up with my fitness and nutrition and whatnot. But with nutrition particularly, there's so much misinformation when it comes to kidney health. And because there's barely any research on what it's like to live with one kidney and your nutrition, doctors use blanket rules and they apply, and it's not that. So there was a lot of trial and error in terms of like what I ate and the protein and things like that. And I've learned it on my own and did the research on my own. So that was a journey. When it comes to actually the physical part of it, it was much easier to maintain after the kidney cancer diagnosis than it was after the thyroid cancer diagnosis. So after the kidney cancer, I shifted, and I hope I'm answering your question, but I always get like insecure about things. But so after the kidney cancer diagnosis, and like I gave myself that time to heal. I went from doing kickboxing to doing bodybuilding because I know that like combat sports, to be, honest, it is a little bit more risky when you have one kidney because there is a higher risk of injury, right? And so for me, I was on this path of possibly competing in Muay Thai. And then I'm like, you know what? I'm not going to risk it anymore. But like, I still want to build muscle. I still want to keep up with it. What can I do? And so I shifted to bodybuilding. But I still love cardio. I'm probably like one of like maybe five bodybuilders who actually like doing cardio outside of prep. So after the thyroid cancer diagnosis, that's, I think, for me, where things really changed when it comes to my fitness and nutrition. Because, and as you may know, because you're also on Synthroid, I'm on a high dose of Synthroid. And that is to keep my cells from growing because there is microscopic disease. And so when you're in a hyperthyroid state, your body's constantly burning, right? Constantly and constantly burning. So my metabolism is going and going and going, which means I'm constantly fatigued. And the idea of getting on my Peloton, like just even turning it on, before I was doing it like a few days a week. Now I do it maybe a couple of times a month because it's just the idea of it's exhausting. Or the idea of like pulling out my kickboxing bag, um, setting up my laptop so I could go on the app so I could do a session. That's exhausting. So I ended up getting a walking pad and I found a way. I'm like, okay, what are the ways in which I can keep up with what I'm doing? But it has to look different for me. But it just, again, I hope that answered your question. But I think for me, it was just more of like fitness and nutrition became non-negotiables for me because that was grounding for me when
Mm,
everything else in my life was just kind of going to crap.
yeah, no, and it did answer my question, and I agree with you. I feel like I don't know if I've shared this on the podcast before, but after not long after my surgery, when I was like still recovering, still using a walker, but I wasn't well enough to go to work, but I was at least like mobile enough to get out of the house. I actually started going to a gentle yoga class, and it was like at my local hospital. It was a great resource, and I encourage our listeners to like look into things like that, in your community. Like I said, this was a free class at the local hospital. It was in the middle of the workday, so I wound up being one of the youngest people in the class, you know. But I really, and what was really nice was there was a lot of adaptive therapies in there, right? Like they even had some people that were in chairs rather than like on a mat, right? So there's ways to work out and kind of get your fitness in without, necessarily, going outside of like what's safe for you as a person. But for me, what I really got out of yoga then, and I don't do it as often as I used to and as I should, but as what I really got out of yoga, especially during that period of time in my life, was it helped me reconnect with my body. It
Hmm.
helped me build some strength and trust back in my body, if that makes sense. Like I felt so betrayed by my body for my cancer diagnosis, right? And then, you have this I had a very extensive surgery, I was really struggling to recover from it, and it was the one thing that gave me some sense of power and control, and I think that we don't always think about the mental aspects of fitness, especially after you've gone through a cancer diagnosis.
Absolutely. So there's one thing I do want to touch on before I
Yeah.
get into the mental aspect. You were talking about like after your surgery and stuff. I do think we do a terrible job as a society of catering to the cancer survivor population when it comes to fitness and nutrition. And I was actually having this conversation with someone recently. Um, you do have some people who specialize in cancer, like cancer fitness, cancer
Mhm.
related fitness. But it's usually typically during treatment,
Right.
right? During a certain type of treatment. But you don't have enough people who are knowledgeable, enough coaches who are knowledgeable of the long-term effects of that treatment of having cancer.
Yeah.
And so there's this expectation that after you're done with treatment, you should just get up and go and do. Um, but depending on your type of cancer and your type of treatment, um, that's not possible completely. And so when you do not have that access to adaptive therapies or adaptive fitness, you shut down and even though you want to do it, you're not going to feel welcomed or motivated to. So I think that's something that needs to change,
I
right?
agree.
Is that I think there needs to be there need to be more coaches who understand what adaptive fitness is
Right.
out. A National Academy of Sports Medicine. That's where I got my, fitness and nutrition certification through. They do talk about exercise during cancer, but again, it's during treatment. And
Right.
it's never treating the person and the long-term side effects. And it's never really taking that into consideration. And I
Right.
think if more coaches did take that into consideration, um, fitness would be more, cancer survivors would be more apt to go after fitness for no other reason than just to move their body, right? Like whatever
Right.
your goal is, but it would be more accessible to them. So
Yeah.
that's just like a soapbox I just quickly wanted to jump on.
No, I agree because I also feel like because I feel like it's still kind of catered towards patients who go through more traditional types of
Yes,
cancer
exactly.
treatment, which of course there's absolutely a space for that,
Yeah.
100%. Not trying to take away you know, from that, but the majority of patients like you and I don't go through chemo and
Exactly.
radiation, right? It's more surgeries. And now I mean, what's crazy is even my diagnosis, it's less surgery and more, I would, statistically speaking, I feel like maybe that's not completely accurate, but I feel like this field is shifting more towards, for at least later stage patients,
Yeah.
to be clear, right? Earlier stage patients still, it's usually surgery, but for later stage patients, it's usually more immunotherapy, targeted therapy combination, right?
Mhm.
And we're still in a space where we're calling targeted therapy oral chemo, which isn't
Yeah.
accurate.
Yeah.
So I feel like that it's challenging because a lot of the resources that are available, and to your point, there's not a lot, but the ones that are usually catered more towards people that have gone through more traditional types of cancer treatment that may not necessarily be applicable to people like us.
Exactly.
Yeah.
And I think even with the traditional treatment, it's again, it stops after the treatment ends, right? It always stops after the treatment ends. But let's, take people like us, for example, rather, because this is what we're talking about. You know, um, for me, myself, I mean, I have to pee more, just to be blunt. Like I have to pee more. I think
Me
I've talked
too.
many, yeah. And again, going back to like doctors use that blanket kind of rule when it comes to renal health on everybody. So it's the idea that, oh, if you have to pee more, then your function must be crap and yada yada. It's like, no, I just have one kidney. Of course I'm gonna have to pee more, right? Like it's filtering as if it's two, right? And that can impact how you work out or when you work out or if you decide to go to the gym and all those things. Or sometimes I get phantom pains on my left side. I did the other day. I'm like, this feels like I had cancer. Because when the one thing that was a symptom that I didn't recognize was a symptom until after the surgery is I had lower back pain that was persistent. I just assumed it was my polycystic ovary syndrome. I'm like, my ovaries being a jerk again. No, it was the kidney cancer because the minute that kidney got out, I don't have the pain anymore. But sometimes I have that phantom pain and I can't move, or rather, because I had surgery there, and like it is a traumatic thing on your body, the way it heals, my left side's not as strong. It's still not as strong as it was. Or if depending on your type of scars and if you have scar tissue, I could do but so many push-ups before like my stomach starts hurting because of my scar, right? And so there are these things that aren't taken into consideration that makes fitness inaccessible. That can make fitness inaccessible if you don't have someone who can guide you or can help you. But I wanted to go back to the mental aspect of it because that's important. That ties into all of this. Um, Fitness is there, like the gym can be therapy. I say the gym is therapy, but therapy is also therapy. There are people who use the gym exclusively as therapy for whatever reason, and it may be that they have more access to that than they do actual traditional talk therapy. Um, but yeah, there is something very mentally fulfilling to be able to move your body in a certain way and to watch it progress and to get stronger in whatever way that might look. It may not necessarily be stronger in terms of muscle, maybe in terms of endurance, and maybe in terms of stamina, and maybe in terms of like core strength, whatever it may be. It's grounding. It give you like an opportunity to like really serious, like sit down and focus and think through things, right? And like you're putting your energy. I think about it in terms of like ADHD sometimes too, because my son also has ADHD because that's the world, right? That's genetics for you. And I was talking to the school psychologist about it, and she's like, the worst thing you could do for him is have him do jumping jacks because that is just going to increase his energy that he needs to expend. It's just going to make him more hyper. What you should do is more something strength based and like just tell him to see if he can move the wall and just push against the wall because you're putting all of that energy and that force into like pushing something that's never going to move. And it also becomes a game, but like you're exhausting yourself that way, right? Like there is actually something strength training is very exhausting, more so than cardio, I think, because like you're putting all your energy and force and stamina into lifting this heavy thing, right? And so if you happen to be a cancer survivor and have ADHD, I really recommend strength training because you could like take all that energy and put it into lifting some weights. But I think, yeah, it is very much a mental thing and a mental therapy, and a therapy for people. That I feel like just needs to be subscribed. It's like prescribed as part of treatment, right? And again, something adaptive, something that fits the person because not everyone could do fitness the same way.
Yeah, I completely agree. And I feel like that's something that, I've struggled to find support, as a survivor, especially a long-term survivor like myself, because, I want to work out and I do, but I have to kind of figure out what works, what will work for me, without injuring myself, to your point, or exhausting myself. And you mentioned like I have a very large chevron scar from my surgery, and I have a lot of scar tissue now, and my organs on my right side have been moved around. They've moved themselves around because I have a gaping hole where my kidney was, right? And it's all these things that I think that I really would like to see, maybe more movement, pun intended, in the field, to
Yeah.
really be able to support patients and survivors in a more inclusive way, So,
Yeah, I agree. And I don't have it as something written out. I did do a presentation for the Kidney Cancer Association and JNF New Orleans event. And it was a little bit hectic because I'm a little bit hectic. Um, but yeah, there is, and I did this for myself, but when there is a way to approach fitness post-surgery in like a very, incremental way. Um, and it hasn't been developed, right? Like it hasn't been developed as part of treatment, but we're constantly told physical fitness is good for your health, right? Physical fitness is good in terms of how you respond to treatment, in terms of your immunity, in terms of all of this, but we don't have those resources to give to people to be like, hey, this is how you can do it, right? Like this is how and I think it's broader than us, like broader than our kind of broader than kidney cancer, but it's like, we have in the field all of these recommendations like do physical fitness this way, but then we don't actually have the tools for people to do physical fitness the way that works for them, right? Because you're right, like people um we just have different levels of strength, different levels of ability. Um and it just fitness should not be made inaccessible because a coach doesn't want to take the time. And this is the thing that I find frustrating with just the fitness industry in general is that coaches don't want to take the time to learn how to modify fitness for their people, right? It's very much like if you can't do it, squat it out. And it's like, okay, but that's not the answer, right? The answer is you being a professional and you doing the research and you figuring out how to make fitness work for somebody, right? Like if someone can't do more than 5 push-ups because they are like their scars are starting to kill them, don't force them to do 5 more push-ups. Don't be like you're just whatever, however you want to be the tough love, right? Like you have to have that compassion and understanding. And I don't want to go on that soapbox because it's a soapbox I could stay on for like hours. But it's just that like that support and that compassion that we don't have for cancer survivors, despite us wanting to say we do. We
right,
just don't. We just have this expectation that they will figure it out on their own. But if you don't have the tools in the first place, right? Like the only reason why I was able to figure it out on my own is because I had the tools in the first place. If I didn't have
right.
the tools in the first place, I wouldn't have figured it out on my own, you
Yeah,
know?
yeah.
So,
I get that. And I think too, I think it's why it's important for patients to remind themselves of being a good advocate for
yeah.
themselves, because even like I have a doctor that I see have been, trying to lose weight, right? And so I, started going to my doctor, and she knows I'm a kidney cancer survivor, right? She knows I've had a nephrectomy, but we were talking and she was like, yeah, we want to like increase your protein and all. And I was like, hold on. I only have one kidney. I know obviously I need to like yes, I should be trying to, do as much protein as I can, but like what's healthy for me because I only have one kidney, right? Like does there need to be a modification to that? And she's like, oh, I wasn't even thinking about that. And she's like, hold on, let me get back to you. And so she did. She like did some research, called like, a nephrologist that she knew and like, then got back to me. She called me, later that day and said, hey, I think we should do this, right? And it was just a simple modification, but in all fairness, our providers, whether it be a fitness provider or a medical provider, what have you, don't always like they forget sometimes, because of their caseload and everything, right? So I think it's just good for patients to speak up whenever they, just go, hey, just a reminder, I only have one kidney, or, I'm a kidney cancer survivor, or what have you.
Yeah. The protein discussion is one of my favorite discussions. So I'll go on another soapbox. So in my experience, nephrologists are terrible when it comes to the protein discussion. Um, and this, I mean, this is just a little bit a knowledge drop for your listeners.
Yeah.
Creatinine is an unstable marker of kidney function. If you are, like myself, have a higher muscle mass, your creatinine will be higher. Um,
Mhm.
if you have a muscle wasting disease, your creatinine will be lower. If you do a blood test right after you do exercise or you're dehydrated, your creatinine will be messed up, right? But unfortunately, and the formula for figuring out your GFR is like your creatinine plus your age plus your weight. It's not a very good formula, and there's actually a lot of controversy around it. Now, I am not a doctor. I'm just a well-researched coach. But I've written about it a lot. I've really researched it. So the way in which we measure kidney function needs to change. Like that is something that really does need to change, especially because there isn't research for living with one kidney. And so we're applying what it means to have two kidneys to someone who has one kidney, and the one kidney is doing the function of something else. And like, so there's all of that, right? And so I don't know your kidney lab, so I'm not going to tell you how much protein you're supposed to have. But, things that come into effect are like, okay, if your creatinine is the only thing that's higher, you could likely have more protein. If your activity level is high, you need more protein, right? Like you can't just have the baseline. And so I think nephrologists really do need to do a better, like, I think there needs to be, I shouldn't be like they need to do, because you're right, they have a caseload, they're busy, like they might not think to do that research around nutrition. Um, so I think there needs to be some standard that changes, and maybe us as kidney cancer survivors are the advocates for that change, right? To be like, hey, we need you to really like understand what it means to have one kidney and live with one kidney and how these labs look. Now, there are renal dietitians who are amazing out there who like really understand like that kidney nutrition really is personalized and you can't have those breaking rules. So yeah, so that's one little soapbox I wanted to go on, right? Again, not a doctor, but done a lot of research, looked at it, there it's out there. We just, if you want a more stable marker of kidney function, ask your doctors to check your cystatin C. I don't know the pronunciation, but that is a more stable marker because it is not impacted by variables like dehydration or exercise or high protein diet. I'd say for our community, the thing that a lot of fitness coaches don't really understand about protein or don't really focus on that I try to do as a coach is think about timing and distribution. And so with, there are studies, a lot of studies out there that show when you distribute your protein throughout the day and when you have like 20 to 40 grams after a workout, you're really like optimizing protein muscle synthesis there. So when I coach my clients, and they may have like protein restrictions, I'm like, okay, we can't get around the protein restrictions, but we're going to optimize what your intake is. And so we're going to now, there are studies that say you could eat like 100 grams of protein in one meal and your body can absorb it, but we're kidney cancer survivors with one kidney. We're not about to do that. And so there are studies out there that show like 20 to 40 grams of protein, like a few hours after you work out can really help optimize, like maximize muscle synthesis. So that's kind of just things for you to keep in mind as you navigate the protein intake for your goals is just think about distribution and timing.
I'm learning so much. I love this. Thank
I
you.
just that was the one thing like because again I was so into working out and
Oh,
everything like I
yeah.
was eating protein and so when I was first diagnosed and went there I'm like I didn't have any information. My
Right.
nephrologist was not helpful whatsoever. She's like just eat 60 grams. I'm like no, I know that that's too little for me.
Right. Right.
And you're not helping me. So I had to do a lot of that learning on my own.
Yeah.
And I'm a journalist by trade, so like I knew like what to do. But again, if you don't like going back to you having to advocate yourself, if you
Right.
don't know where to go, where to start, like how do you advocate for yourself?
Yeah. It's tough. I mean,
Yeah.
I'm almost 9 years into this, and to your point, I, I'm not a journalist, but I have some, training and all right, and I'm communications and marketing by day, cancer survivor by night, as I like to joke, right? And so it's like, yeah, I know how to communicate and advocate for myself, but sometimes you just don't know the right questions to ask. So I think it's why it's really important that patients are looking for credible sources in the field. So I did want to shift gears a little bit because you've talked about, advocacy. We both talked a little bit about advocacy and advocating for yourself. You're a very active kidney cancer advocate as well. And I always admire that you have the time to juggle, job, family, and advocacy. I know that you're involved with the KCA's patient advisory board, and I know that you do podcasts for them, which I have to ask you. Please tell me that Kidney Cancer Unfiltered was a deliberate choice because, like,
Of the name.
filtering, yeah, the
Yeah.
name.
It was absolutely a
Yes.
deliberate choice. I didn't come up with
Thank,
it. That,
okay.
that was a KCA,
I
the
love it. That's why I'm saying,
yeah.
please tell me it was a very deliberate punny choice.
Yeah, it was absolutely a deliberate choice. It was, and I when they came when they came with the suggestion of the name, I'm like, absolutely, like that's
Right?
absolutely what we're naming it. Yeah, I like you got they came up with their name, and I just like rubber stamped it with the hugest biggest rubber stamp I could like find. So
I'm like only moderately jealous. I didn't come up with myself. Like it's hilarious. So
I am jealous. I am upset that I didn't come up with myself, but yeah, no, it was a deliberate choice.
yeah. But so what motivated you to get into advocacy work whenever you started your journey?
Yeah, so I think it's just a natural extension of myself as a journalist, right? So I'm in communications now because I have to pay the bills and I need a health insurance. But when I started journalism and I have a bachelor's and a master's in it, and I've written for all these much places, my focus was around like public health and social justice, right? And so I was always motivated to advocate, and particularly like amplifying other voices and challenging the status quo of things. And so I think when I was diagnosed with kidney cancer and I saw that, kidney cancer survivors really, especially in our age group, weren't really being represented. And our experience with treatment weren't like wasn't being represented, and our survivorship experience wasn't being represented. In me, I'm like, I need to find a way to change that, right? And my why is shifting over time because there was also a part of the advocacy. I'm like, okay, going back to fitness and nutrition, but we'll stick with advocacy. That was part of my advocacy too, because I'm like, there isn't research out there for us. There isn't information out there for us. We're using this like status quo to apply to people who do not fit the status quo. And so that's something I want to change. So I guess that's really what across the board motivated my advocacy is to just increase that representation of our experiences. And, I would say recently, as of today, in thinking about my legacy and legacy building, because that's part of the conference I'm at, which let me give a shout out. We're doing this while I'm at Baggett's Escape to Thrive conference for cancer advocates and survivors, and it's a leadership conference, and it's an amazing experience. But we were talking about legacy building today, and I was just like, okay, what do I want my legacy to be? And it really comes back to that. It's changing the narrative of what a cancer survivor looks like. Because I think within our community, within the broader cancer survivor community, we speak in very traditional terms. It's very much like chemo brain and ringing the bell and this and that. And it's like that's not our experience. That will probably never be our experience, right? And so you end up internalizing messages like, am I the right kind of cancer survivor? Am I even doing cancer right? I don't feel like I'm doing cancer right. I just had surgery. But someone said to me today to like reframe it as surgery was my treatment, right? And I'm kind of going on a tangent here, but I think it comes back to like, for me, it's just I'm so motivated to change that narrative. And maybe now will be in the broader community too, not just for like not just within the kidney cancer community, but like the broader community. But I didn't see myself represented in cancer. And I didn't think it was fair to us to be made to feel unremarkable, right? To like go and get your kidney removed, come back out, and it's just this unremarkable experience, but it's still a traumatic experience. Like your treatment is separate from the experience of cancer itself. So yeah, I hope that answered your question. I am so,
No.
just side note, so insecure and so anxious and like anxiety ridden that I will assume that none of what I'm saying is actually answering your
It
question.
made a lot of sense, and I get it. For our listeners, we were talking about before the podcast about ADHD and and everything. And so I get it. I like live with a massive case of imposter syndrome every single day. So I totally get it. But no, it made a lot of sense. And I think that um you brought up a really good point about how it kind of goes back to what we were talking about earlier, just how our disease looks so different in many ways from like more traditional, more common types of cancer, right? And like most of the time, people hear I'm a cancer survivor and they think that I had breast cancer
Yep.
because I'm a woman,
Yep.
right?
Hmm.
Or like you see these commercials of patients, with like like they have a cap on because they've lost all their hair and then ringing the bell. And for me, it was really emotional the day that I decided to stop my targeted therapy treatment with my doctor's approval, right? We agreed that it had run its course. I had enough NED scans that, it was time for me to see if I could be off treatment and still maintain NED, right? To help with the side effects. But like I just walked out the clinic that day.
Yeah.
There was no bell ringing, there was no, you know, cheering and not that I'm happy for patients that get that experience, obviously, right? But it's hard because I think you brought up a good point where like people have this perception, especially if you or a loved one haven't been diagnosed with cancer, that you've been diagnosed with cancer, you have surgery, maybe you do, chemo radiation, and that's it. And then
Yeah.
life goes back to normal, right? And
Hmm.
for me, honestly, the hardest parts of my diagnosis were, at least the first year, were actually the couple months after my surgery. I was still recovering at home. I, wasn't able to go back to work. I was having to like have home health come in and everything, right? And people were really great about like showing up whenever I was first diagnosed, which I appreciate, obviously. But if it felt lonely, right? And people kind of like, oh, I thought that like whenever I said, hey, I have to start treatment, people were like, I thought you had surgery. I thought everything's fine, and it's like,
Yeah.
no, it's not how this works. And even if you don't have to do treatment after surgery, it's still like, to your point, it's still a traumatic experience that will be with you the rest of your life.
We had a whole organ removed. Like that's
Yes,
the thing. Like we had a whole vital organ removed. Like I
right.
I don't know if you've gotten this, but I've heard when I was first diagnosed and I had it removed, it's like, well, at least you have two.
I've
And
heard that too.
here's the thing about the kidneys, and I know everyone listening to this knows this, but maybe there's someone who's listening and doesn't know this. Your body, your kidneys help your body function.
Right,
And if you lose one, your body has to function differently, and it may not function differently in a good way, right? Like it's not like your gallbladder or your appendix that if you remove it, like you literally are fine, right? You
right,
might have to change your diet. No, you have so much more to worry about when you remove one of your organ, like one of your
right,
kidneys. And you're at higher risk for things when you remove one of your kidneys. I think it's also with my thyroid. I had my entire thyroid removed, and it's like thyroid cancer does have a really great prognosis. I am not going to deny that. Um, but I cannot stop my synthoids, otherwise I will die.
right.
Like your thyroid's I had this male coach, but he told me that the thyroid is not responsible for metabolism. And I'm just like, you're saying this to a thyroid cancer survivor. Oh my God. It is. And that's
Right,
why you're put on, once you remove your thyroid, that's why you put on lifelong medication because you
right,
need your thyroid free metabolism. If I ever go without my synthroid, I will cease to function. Right.
right,
And
right,
so it's like surgery is never just surgery
right.
know, when
Yeah.
it comes to cancer. Like cancer changes your life, and so does that treatment, right? It's the
Yeah.
same thing like more traditional therapies. You do have side effects of those traditional therapies, long-term side effects. It's the same thing for surgery.
Right.
But like there's still, and this is not one's worse than the other, right? Treatment is
Yeah.
treatment, cancer is cancer is cancer. But the narrative is still very much this like cancer is a plot device and everyone is going through chemo and dying,
Right.
and it's like that is not our experience. And I
Right.
think that representation really does need to increase because cancer is traumatic. And for some people, cancer doesn't stop with just that surgery because there's recurrences and there's other primaries. And it's like, it's never one and done, you know?
No, no. Unfortunately, that cancer card is not good for a one-time trial,
Yep.
unfortunately,
Yep.
as you well know.
Yeah.
Um, I know that you're at your conference, so I want to be respectful of your time, and I really appreciate you taking the time to, it speaks to the level of commitment that you have as an advocate that, you're at this conference and you were willing to do this podcast with me. And, we are better as a community because of advocates like you. So thank you. I appreciate you taking the time. But I just wanted to ask as we kind of wrap up,
Yeah.
what's if you could just offer one piece of advice to someone that's newly diagnosed with kidney cancer, or maybe a caregiver listening that, supporting their loved one through this, in the beginning, what would that advice be?
Um, So I think it goes off of what we were just talking about. First of all, thank you for your advocacy too. Like I appreciate your kind words, but I want you to know that those feelings are returned from what you do for the community and everything that you do behind the scenes. And I think a lot of us do stuff behind the scenes and the unsung hero thing. So I just want to publicly thank you as well. Um, I think it goes back to what we were just talking about. Now, I don't want to say I'm being a hypocrite, but I'm definitely not taking my own advice because I've internalized messages and I compartmentalize and I still but it's just to remember that your story matters. It's surgery isn't just surgery, if that is what your treatment is. Stage one isn't just stage one. I was stage one myself. It just means and lucky might not be the right word, but let's go with it. It just means that you were lucky enough to detect it early, right? But that does not diminish your experience of cancer. So you deserve to feel your feelings. You deserve to call yourself a survivor. Um, and your surgery is a treatment, right? Like that reframing that one of the conference attendees says, like surgery was my treatment, and that's it, right? There's no only. That was your treatment option. I think obviously the typical advice stands like turn to places like JNF and KCA, get yourself resources, connect with other survivors. You don't, people say peer support groups, and I think peer support groups are great. So I personally am not a peer support group person, but I was able to find connections with people one-on-one, and that was very helpful. Or in very small, like with you and Katie and like all, Kayla and Catherine and Melissa and you can name Tracy and all of them, we have a little like Chromie group. Um, but like find your people too. Like if you're newly diagnosed, not only just you have the self-advice of recognize that your story matters and that your legacy matters and that it's there is no just, right? You matter. And then on the other more practical, I guess tactical, whatever you want to call it, side, it's look for those resources, reach out to people because you're not alone. And there are many people who are willing to help and be mentors and mentor you through it, even if it's just one time. You don't have to go to Facebook. You don't have to like do peer support groups. Again, not crapping on them, but more of like, it doesn't have to be that way. It could just be one-on-one, but like still find your people to help you through. So you're not doing this on your own because that's just going to make you sicker.
Yeah, I completely agree. for me, and I'm like you, I was involved for a while in the peer support groups online, which are wonderful resources.
Yes.
Um, I find the longer that I'm out, the more that from my initial diagnosis, right? The more that, it's just not the place where I find the most support anymore, right? Which is okay. I'm not like I find support whenever I visit it, but it's just I'm just not in that space in my life anymore, right? I'm not actively on treatment, thankfully, right? But one thing that I found was there was a group of us that saw the same doctor when I lived in Vegas, and we would go out to dinner once a month, right? And so, to your point, just finding those little specks of community are so important because it can be a very lonely disease at
Yeah.
times.
Yeah.
And I could not have gotten through this without the support of other patients, like you, like Katie, like so many others, right? And unfortunately, so many that are no longer here. But it's important that we have that community, whichever way it speaks to you. And so, to your point, there's excellent resources from JNF, excellent resources from KCA and other groups. And so, just if something's not resonating with you, I always say just kind of keep looking. Something will resonate at some point.
Yeah. And you can reach out to me, although after like this month, I'll probably won't be on Instagram much, but I have a Facebook, I have a LinkedIn. But the lonely part, I wanted to touch on that
Yeah,
because you're right. It is, if you are younger, and especially if you're a woman, you're going to often be the only one in the oncologist office with kidney cancer, or the only one in a conference with kidney. I'm the only one with kidney cancer here.
right.
Um, and everyone's been wonderful. So it has nothing to do with them, but sometimes it can be really lonely when you don't have someone in your immediate space who can relate to your experience like closely, right? There is a collective cancer experience. So I do say don't silo yourself either, because there is a collective cancer experience. But finding that community of other kidney cancer survivors is also going to be really important, because you're going to want to be able to like reach out to someone and be like, hey, my pee was frothy the other day and I like watched it all the time. Turns out it was just the monostat I was on, to be crass, but like I spent the whole day anxious that like my kidney was failing, right? You're gonna want to be able to like talk to someone who understands that. And heck, you other GU cancers, because there are a lot of similarities and
Yeah,
like rectal and uterine, like there are a lot of similarities there. Like we all have to pee a lot. Like we
right,
all have to pee a lot.
right,
And and like just having a community that can understand those kind of symptoms, I think is important. So it's like don't silo yourself, but yeah, it is important because it can be lonely.
yeah,
Won't find you might not find someone like you in like your vicinity.
right, right, exactly. Yeah. Yeah, I mean, I have my group of people I reach out to in the middle of the night when I'm going, I have this weird pain. I think it's probably fine, but
Yeah.
I don't know what it is, and
Like
am I dying again? I don't know, right?
like I have flank pain here and I don't know if the cancer came back. Like, what is this? Like
Right,
those
right.
things, like, and again, I think that's also part of the collective cancer experience. We all have those like we feel aches and pains and we all think it's cancer. But I think, there is something to be said about like connecting with someone who understands your cancer like personally.
Yes, 100%. Well, I mean, I feel like that wraps it up. Like, what a great note to wrap on. Um, Annamaria Scaccia, thank you so much for your time today. This has been a lovely conversation. Again, I hope you enjoy the rest of your conference. I hope it sounds like it's been a great experience. And I hope that, it goes really well for you the rest of the time, that you get some me time in while you're there.
Thank you. Yes, I have a facial, and I'm first time I ever had a facial. I will ever have a facial, so I'm very excited. I do want to, again, if it's okay, just give a
Absolutely.
shout out to Bag It. It's a Arizona-based or cancer organization. They have this Escape to Thrive conference. Check it out. Look at it online for if you're an advocate and you want to improve your leadership or become more of a
Yeah.
leader in this space. It's a great resource. I just want to be able to shout it out.
Absolutely.
You
I'm like
know,
gonna go Google it now.
yeah, honestly, yeah, and it's open
Yeah,
to everyone. It's a very focused on diversity and equity and
that's
inclusion. So,
awesome.
like, there is a space for you, whether you have cancer or not. But if you're an advocate in this space, so I just wanted to
Awesome.
shout it out a little bit.
Thank you. Well, you can catch her on Kidney Cancer Unfiltered. And again, really appreciate your time today. And this has been another episode of Real Talk on Renal Cancer, sponsored by the Judy Nicholson Kidney Cancer Foundation. I'm your host, Laura Esfeller. With thank you again to Merck for support for this podcast, and we'll see you guys next month. Thank you.